So this evening, again, we just want to remind you of who we are. We're DRD Natural Health, and we do health consultations for persons who are willing to change their lifestyle and to do it naturally. And it's a total lifestyle change that we look at. And we encourage you to visit our YouTube page and to also tell your friends about it. Maybe there are persons who cannot join, but they can definitely watch the videos after. And our Facebook page as well. Both the Facebook page and the YouTube page are DRD Natural Health. So you can just search for that on YouTube or on Facebook. And of course, if you want to contact us, you can contact us by email at drdnaturalhealth at gmail.com. And or if you want to contact us by phone, then it's 647-465-9442 or 613-800-8655. That's our numbers. All right. So this evening, again, we just want to remind you about our disclaimer. We have a disclaimer that some of you are familiar with. That is that the information provided this evening is for educational purposes only and is not intended to diagnose, prescribe, treat, cure, or replace the recommendation of your healthcare professional.
Yeah.
Okay.
And we just want to remind you that this is being recorded. So just to let you know about that.
Okay. All right.
So
what are we talking about this evening? You tell us.
So this evening, we're going to be talking about asthma, right? And, you know, a lot of us, we've either experienced it or we know someone who's experienced, you know, asthma or the complications related to asthma. And so we just want to go over that a bit this evening.
Yes, and sometime later, then we have someone who will talk to us from a personal perspective.
Yeah.
They've actually experienced it, and you know, they will let us know some of the things that they have experienced.
Yes.
Okay.
All right. So asthma, as we know, is a respiratory condition, right? So it affects the lungs and it makes our lungs very sensitive and it makes it hard for us to breathe. Now, there are some treatments for asthma, pharmaceutical treatments, but we also will touch on some natural treatments that can be used later. Now, if you have asthma, basically what happens is your airways, right, they become narrow and they become inflamed, or it's the inflammation that makes them narrow. And because they're irritated, right, it could be by an allergen, it causes them to create more mucus, right? And then you can also have a cough with that.
Okay, so do you want to show the page?
So we have a picture to show everyone. Let's see about what happens with asthma. So this one. Okay, so I'm hoping that you guys can see that. I'll make it full screen. Okay. So number one is a normal airway, right? So these little bubbles here, they look like grapes. This is the alveoli, right? This is where the gas exchange takes place. But in the tube portion, you can notice that it's clear, it's wide. You know, this yellow layer is not very thick, right? There's a thin layer of mucus going around. But when you have asthma, here in this picture number 2, you can see that there's some allergen, something, this is just an example, you know, something they've inhaled, you know, gets down the trachea, down the bronchi, And when we look at what's going on, we notice that the bronchi become tight, right? It gets irritated and it tightens up. And we notice there's inflammation. So you can see even the color is a bit darker than the normal airway here. And you notice that there's even more mucus lining the bronchi or the bronchioles. And so that's just an example of what happens when your airways become inflamed and tight and filled with mucus. So imagine trying to breathe through this tube compared to tube number 2. Right? Obviously, there'll be some restrictions when you're breathing through this tube here.
Yeah.
Okay, so let's go back here.
All right.
All right.
So I'm not sure if we have persons on who maybe have family members who are asthmatic, or even they themselves who may have had that problem either from childhood or developed later on in life. But the information is for us so that we can also share it with others as well. Okay.
Yeah, so we talked about the airway being swollen and filled with mucus. The airway is also smaller and tighter. And we also talked about the cough, because if there's a lot of mucus, your body is naturally going to want to expel that mucus, which is, one of the reasons why you're coughing to get that mucus out.
So that's the body's way of saying something's in here, I don't want it. So let's get rid of it. And I'm sure persons who have had this condition for some time, they know when an attack is coming on, that they should be maybe grab the
inhaler, the puffer.
Okay. So 80% of asthma problems are caused by allergies. And there are a lot of things that can cause allergies. And we will look at some of those. And sometimes when the attacks are coming on, they are sudden. Sometimes they're gradual. And in the last decade, the number of asthmatics in America have increased by 1/3. So many more persons are having this condition, and children under 16 and adults over 65 suffer the most from this condition.
Before you move on, I remember younger, I just thought that asthma was just for younger kids. But, after learning more about asthma, it does affect, the older population as well.
Yes. And it is a leading cause of disease and disability in the age 2 to 17 age range. So there you go. As you mentioned, a lot of young people would have it. And at times, the coughing is just what affects people the most. Or
you want to cook? I bring one down. Is it on the door there?
We're just going to remind you to mute your device, please.
Yeah, so that's what would affect most of the population back then that you are familiar with. Yeah. So I remember Deandra going to the hospital for some cough that she had, and I think Daddy took her, and she came back with a puffer.
Really?
I
don't remember this.
Puffer, and the doctor, thought she had asthma, but of course, it wasn't so. I'm happy for that. Praise God. Okay.
So asthma, as we've been saying, it affects the airways, right? So obviously it's going to affect the air that's coming in, and it's going to affect the air going out. And we've already spoken about the importance of fresh air.
That's right.
Right? And the inflammation and the mucus and the tightness can cause certain symptoms, right? So there's certain symptoms that are specifically related to asthma.
Right.
Do you want to talk about some of those symptoms?
Yeah, I could talk about some of those symptoms.
You didn't sound too sure.
Okay, so some of those symptoms are they'll find out that they'll be wheezing, right? So there's a like a whistling sound when they breathe. There's the coughing that we mentioned. There's tightness in the chest area. The mucus, like when they cough, there's mucus and shortness of breath. They're usually breathing faster
and shallow.
Yes, because they're desperately trying to get that air that each of us so need for our lives in order to continue to live a healthy life. So, and there's the difficulty breathing, and that is worse at nights. We're not sure why when we're sick, we get worse at night. I just believe it's the sunshine.
But based on the symptoms that my mom just listed, if we just think about the picture that we showed earlier, you can really see how these things will happen because the airway is narrow, there's more mucus, so obviously you won't be able to breathe. You'll have tightness because you can't get the air in. It makes sense.
It makes sense. And I can imagine for someone who is suffering from this condition, I can just imagine how they feel trying to breathe.
Get that air.
This is what we need to survive. And then you can't, you realize you can't get that at all.
And the other thing is we breathe without even thinking.
Yeah, that's normally.
And then all of a sudden you have to start thinking about every breath.
Yes.
Yeah.
So for those of us who are not asthmatic, the ones who are, I'm sure they appreciate fresh air so much more than those of us who, just go about every day just breathing normally. Yes.
So there's different types of asthma. There's intrinsic and extrinsic asthma. So extrinsic asthma usually starts in childhood and is related to like seasonal allergies. And intrinsic asthma is more severe and usually develops after the age of 30, right? And these attacks can occur at any time and they're difficult to identify. The causes of these attacks can be hard to identify.
So when you say the causes, what are some of the things that can cause asthma in either the intrinsic or the extrinsic, right?
So we mentioned earlier allergens and irritants. So a lot of things can be allergens around us. And maybe we could just ask you guys to type in the chat, what are some allergens that you can think of?
What are some things that would cause
that could
an
irritate?
Asthma attack? Yes, like that the picture you saw those little things going into the nostrils. What are some of those things? Okay,
smoke and pollen.
That's right.
Pollen is a big one.
A big one. Very big one. Any more? There's smoke and pollen and
think about everyday things that are around us. Insect spray.
Oh yeah.
Yes, a lot of sprays are very irritating.
A lot of sprays. We have in our homes some of those things that are irritants as well. Paint fumes, right? Perfume. That's correct. Okay. All right. And some other things that you did not mention, there's mold or chemicals. Did we say chemicals? Chemicals or drugs, dust mites, the carpets, those things that are in the carpets, food additives. There are a lot of foods that have things added to them that are also causing irritation. Medication, there are some medications. Someone put that in the chat as well.
Yeah.
So yes, that is correct. Tobacco smoke, someone did mention that one, right?
Yeah.
Animal
dander. Yeah, so a lot of people can't have pets because, you know, their hair, right, is an irritant to them.
Yes.
And some people, they love their pets so much they still keep them around.
Feathers too. You know, some persons are allergic to feathers. And there's some other things that you would probably never give thought to. Anxiety.
Yes.
Fear. You know, someone gets anxious, then they get an attack. But laughter. Laughter is good medicine. Remember, laughter is good for the soul. Laughter is good for the entire body, and it's good for the bowels.
Yes.
Well, if you laugh too much.
No, this is if you're asthmatic.
Right.
Yeah, these are triggers if you are asthmatic. So don't go away thinking you can't
laugh enough, right? Okay. And stress. Oh, stress is right across the board.
Yeah.
It's a killer for just about every condition. Low blood sugar, adrenal disorders, sudden temperature changes. That's another trigger as well.
Yeah.
That will affect some persons, which is again why we encourage persons to dress properly, you know, ensure that the limbs are not cold, either the hands or the feet, that they are not cold, that they're properly clad at all times. And extreme dryness or humidity, that can cause it as well, in addition to respiratory infections.
Yeah. So we mentioned that, you know, we want the air is essential for all life, right? And if there's impure air around us, then especially if you are asthmatic, this can also be a trigger. So what are some things that we can do? Well, if you weren't here for our talk on pure air, you can go and watch that on YouTube to get more information on things that you can do to ensure that the air around you is clear. Clean
and pure.
And pure.
Yes.
But do you remember any of those quick tips that we can share with people right now?
Yeah, they want to ensure that they're, like, for example, plants in the home, that will help to get fresh air. The windows, that the windows are open. The air must be passing through the house. So you have a window open on one side, one on the other side, then the air is able to pass through. That you have fresh air moving through the room at night while you sleep. You know, those are some of the things that you go outside in the mornings and you inhale. So you know, you get out that stale air and you get fresh air in. And yes, those are some of the things that we had mentioned.
So we mentioned already, you know, those symptoms of asthma and what they can look like. But, you know, a lot of other lung conditions have some of these similar symptoms
as well,
right?
Yes.
So what are some things that we need to look out for a person to say, you know what, this is different, I need to go get checked out?
Okay. So go get checked out means that you're either you have someone that will take you to the hospital, or you're gonna call for help, right? You're gonna call 911. So if you're struggling to breathe, then you need to get attention right away. If you have difficulty speaking and you can't finish your sentence, you're sucking in skin through your breastbone and between your ribs, you know, it's because you're struggling so much to breathe, then it's going in when you try to inhale. And your nostrils are flaring up, your complexion is changing, you're getting pale or gray, and you're sweating. You feel really tired or lethargic, then you know something is wrong. And if someone else is there and they get unconscious, that is also a sign. Call 911.
Another thing I would add to that is if you cough up blood, right? That is definitely a medical emergency and you need to be at the hospital.
Right.
Yeah.
And I would suggest that if the hospital is far, it's best that, well, maybe depending on where you are, it's best that you call 911, because at
Yes.
least when they come, you know, you will get, they will put the necessary equipment on so that
yeah.
you're getting air while you're being transported to the hospital. Yes.
Yeah. So these are medical emergencies that should be taken seriously, right? I don't know if you mentioned the nails. If you notice the color, losing color in your nails, that means the air isn't even getting to the tip of your nails, right? So
Yes.
that's an issue with your respiratory system as well.
Okay.
Yes. So we want to go through, you know, some things that we can do to help, some general things, and then we'll go to some more specific things.
Okay.
So certain foods can trigger asthma, right? And remember, when we're talking about asthma, we're talking about inflammation and a lot of mucus. So it makes sense to think about, you know, what are those foods that cause inflammation
or mucus,
inflammation and mucus secretion. So if you weren't here for our food discussion, you can go check out our YouTube video where we talk all about foods and inflammation. But some of the foods that can trigger inflammation and mucus formation are dairy products, right? So dairy can cause your body to produce more mucus, right?
Yes.
And so that's something you would want to remove. Also, meat products. Meat products cause inflammation, not only in, you know, the digestive tract, but also in the respiratory tract as well, right? And we've talked a lot about breathing, right? Breathing is so important.
Okay, so we want to ensure that we're eating a lot of vegetables and fruits, right? Ensure that you're getting a lot of that. In addition to that, add a lot of garlic and onion to your cooking, right? It's very, very important that you do garlic. Garlic is by itself an antibiotic, so it's very good to have. For those persons with those conditions, they can have more garlic in their meal. Just remember that the fruits and the vegetables, you don't want to have them together. All right. And maybe you remember, what is a fruit? How do you differentiate a fruit from a vegetable? Can we put that in the chat, please? How can we differentiate a fruit from a vegetable? For those who fruit has seeds, okay, but can you be more specific? That's correct. Fruit has seeds, but where is the seed? Where is the seed? Good job. Good job.
It's like she's a teacher. Good
inside. That's right. And the reason I asked, because the vegetable has seeds as well, right? Yeah. The kale.
Oh, you mean, okay, that's what you mean.
Yes, but their seed is on the outside, right? So the seed is on the outside, but the seed and the fruit, it's on the inside. You can stay there and laugh.
No, I was just in shock because I was like, vegetables have seeds. Okay. You know why she can say that? Because she's a gardener. Okay. Yes. So those of you who are getting your, you know, garden preparations going, you know that you definitely need those little seeds to start those seedlings to get going around this time.
All right. Okay.
So yeah, we want to eat our vegetables and fruits. They have antioxidants that can help reduce that inflammation, right? Some other antioxidants would be like vitamin E, vitamin C. Some other foods, or another food group that we want to think about eliminating, is sugar. And I think we've spoken about sugar before. Yes. Sugar causes inflammation. And if you have a condition that has inflammation, you know, those two won't go together, right? So we definitely want to remove the excess sugar, right? So we're talking about a lot of baked goods. And remember that our those simple carbohydrates. So in those like processed foods with a lot of flours, those turn into glucose in the body, which is sugar, right? So that's why we want to promote more vegetables, more natural sugars from our fruits,
Mhm.
to reduce the inflammation. So Michelle is saying, what about milk products? Does that cause inflammation? By the way, I drink almond milk, LOL, just saying. Yes, so I mentioned dairy products earlier, which would include the milk products as well.
Mhm.
So those do cause inflammation.
Inflammation. Yes.
Okay.
And I mentioned I have lots of fruits and vegetables,
Mhm.
but if you are having an attack or you're just getting over an attack, you don't want to have ripe banana,
Mhm.
because ripe banana is it's mucus forming,
Yeah.
so you don't want to have ripe banana while you're having an attack.
Mm-hmm. And so other foods that can create mucus, we mentioned refined foods, white foods that don't have a lot of fiber in there. We mentioned the dairy, cookies, cakes, pies, all those things that are full of sugar aren't very good if you have an inflammatory condition.
Hmm.
So
if you if you're making them yourself, right,
Mhm.
then you can you can put less sugar in it,
Yeah.
or you can choose to put less flour in it, or you
Mhm.
can choose to use a different flour,
Yeah. A
a
healthier
healthier
flour.
flour
Mhm.
as opposed to a white flour,
Yeah.
that kind of thing. So for it's not like these persons are diabetic, so they
Mhm.
can make their things, their food items, their desserts for themselves, and make it healthier.
Mm-hmm.
Hmm.
Now, wheat can also be one of those foods that can cause inflammation in the body. Now, not everyone needs to eliminate wheat. This is a personal decision,
Hmm.
right? You have to listen to your body, look at the symptoms that you're having, speak to your healthcare professional to say, okay,
Yeah,
I might need to eliminate wheat
this. Hmm.
to see, if my symptoms change.
Right.
Mm-hmm.
And I'll go back to the fruit.
Mm-hmm.
There's the melons, or
Mm-hmm.
those in the melon family.
Yeah.
They might want to eliminate those as well. The watermelon and cantaloupe,
Mm-hmm.
and what's the other one?
Honeydew.
Honeydew.
Yeah.
Yeah, because those are in the ragweed family, and they can trigger an attack for some persons.
Yeah. So if you do have, ragweed allergies, then you might wanna, stay away from these
Right.
these fruits.
Hmm.
Another thing is we want to drink more water. Water is so important. Water prevents dehydration, and it keeps the airways, keeps the cells happy, basically, prevents the development of the thick phlegm, right? We don't want that thick phlegm, that thick mucus. So we really want to be drinking our water. And what about, how else can we use water?
A hydrotherapy. We can
Mm-hmm.
use it as a means of hydrotherapy, in that we're doing the hot and cold shower
Mm-hmm.
that we spoke about some time ago, and that definitely helps.
Mm-hmm.
So that's very good, preferably at night, or if the person is at home during the day and they can go to bed immediately after,
Yeah.
because the hot and cold shower is for healing.
Mm-hmm.
And once you have done that, your body needs to rest.
Yeah.
So you need to be in bed for at least at least half an hour, but you want to go and lie down for a bit,
Mm-hmm.
cover yourself, and allow the healing process to take place.
Mm-hmm. Some other foods that can be allergens are chocolate.
Mm-hmm.
I know a lot of people love their chocolate. But if you're allergic, it's best not to
Avoid
to
it.
eat the
Yes.
chocolate.
Yes.
And chocolate also has caffeine in it.
Mm-hmm.
And we don't consume caffeine because of the stimulant effects, the addictive effects.
Mm-hmm.
I remember when I was at work, a group of us were having a conversation about coffee, and they're like, "Do you drink coffee?" And I'm like, "No." And they all gave me this weird look. And one guy, he looked at me and he said, "Don't ever start drinking coffee because you won't be able to stop."
Mm.
Now, if I know that going in, there's no
You're
way
not
I'm gonna
going
start.
in.
No way.
Yes. Yes.
Other foods are soy. So some people are allergic to soy,
Mhm.
and a lot of times it's because the soy that they're getting is GMO
GMOs.
soy, right?
And the
So
same with
with
corn as
corn,
well.
yes,
Yes.
yes. So I mean, if you're allergic, then obviously stay away from it. But if you can, it's best to get organic, non-GMO soy and corn.
Mhm.
Mm-hmm.
And if you're having the any type of food and you think you're having an attack, so this food is triggering an attack, then it's best to do the process of elimination. You're not sure which one it is,
Mm-hmm.
so just start eliminate or just stop everything and then start adding them back one at a time.
Mm-hmm.
And the one that causes the problem, then you know that I
Yeah.
need to eliminate that particular food.
Mm-hmm. So, what are some things that people normally do when they first get an attack?
Well, I believe for most asthmatic, the first thing they would do is reach for the inhaler, right?
Mm-hmm.
So they would walk with it wherever
Yeah.
they're going. It's always in their purse. They have it. So that's
Mm-hmm.
one of the first thing that I know that they would do.
Mm-hmm.
They would reach for the inhaler.
Yeah.
But another thing that they can do is posture.
Mm-hmm.
You know, most of us, we're not sitting properly in the first place.
Yeah.
But in particular, when there's an attack going on, you want to ensure that you're sitting properly, that your back is straight and your shoulders, are back, and so that it helps to open the airways,
Yeah.
so that
Mm-hmm.
more air can go in,
Mm-hmm.
and help which would help with the
Yeah.
breathing condition or the breathing difficulty that the person is having.
Mm-hmm.
So they can, if it's not too bad that you
Yeah.
have to call the ambulance, then you can sit up straight and
Mm-hmm.
sit in that position for at least 10 minutes or so,
Mm-hmm.
and do the inhaling through the nostril and out through the mouth,
Mm-hmm.
and see if that will help. And I know some persons with asthma, as we mentioned before, anxiety or stress, if they get
Mm-hmm.
upset,
Yeah.
they're irritated, then they start breathing faster, and that too
Mm-hmm.
can trigger an attack. So you want to, try and avoid that as well.
Mm-hmm. Okay, so let's get into some, herbs that we can use specifically for asthma.
All right. Well, we mentioned one earlier, which is garlic.
Mm-hmm.
You can have garlic. We're not encouraging that you have it raw, but
Yeah.
that you pour at least some hot water over it, and and drink the water, and then you can eat the garlic. You can
Mm-hmm.
chew the garlic and eat it.
Mm-hmm.
But there's also a garlic drink that you can have, which is to blend 1 clove of garlic in a cup of water.
Mm-hmm.
And you can drink this. And of course, because of the mucus
Yeah.
that's there, it's possible that you might bring it up,
Mm-hmm.
right? So if that happens, praise the Lord, because when that comes back up, the mucus is coming up as well.
Yeah.
So when that comes up, you drink another cup,
Mm-hmm.
right? And
Mm-hmm.
hopefully that will stay down. But if it doesn't, then you drink another
Yeah.
cup as well, because
Mm-hmm.
it is accomplishing, the body knows what it's doing. So if you drink and the body pushes it back out, then the body is cleaning itself while it is pushing it out as well.
Mm-hmm.
There's this herb, mullein.
Mm-hmm.
Some people call
Say
it mullein.
mullein.
It's very, very good for the respiratory system.
Mm-hmm.
And you can also make a tea from it.
Yeah.
It's you'll see it just about everywhere in the summer. It's spelled mullein. You can just research that on Google, and you'll see pictures of this herb. It's very velvety, very
Yes, I
soft
love touching it.
to the touch,
Mhm.
and it's very good. So you can harvest those, dry them,
Mhm.
and use them when you
When you
need
need
them,
them, yeah.
right? And even if you're not asthmatic, you can still harvest them
Mhm.
and keep them. And if you have any other respiratory condition, like even for the current virus, that's very good as well, that
Mhm.
someone can drink. So
Mhm. There's also peppermint oil that you can use.
Mm-hmm.
Of course, we're talking about using it topically here, but if you're going to use it topically, you definitely need to use it with a carrier oil, right? So you would put like a couple drops in some carrier oil, like olive oil or
Mm-hmm.
coconut oil, and then you can rub that on the chest, almost like a Vicks,
A Vicks,
like
yes,
a
like a
Vicks
Vicks
vapor
rub.
rub,
Yes, yes.
right? And that can help to, open up the airways. Even like that steam, a
Yeah,
steam,
the steaming where you put cover
yeah,
the
I
head.
forget the proper
Yes,
name.
yes, that can help
That's
as well.
that's good too.
Yes. And there's also a garlic poultice that
Mm-hmm.
persons can make, and it's fairly easy. And what you can do is after you make the garlic poultice, then you would put it at the on the bottom of the feet.
What's in it?
It's garlic, so you're gonna get 2 or 3 cloves of fresh garlic, and you're
Mm-hmm.
gonna grate those or crush them, and or put them in a garlic press and squeeze it out. Then you're gonna put it in a piece of cheesecloth
Mm-hmm.
or paper
Yeah.
towel, and or any other very thin fabric. Put your
Mm-hmm.
foot on it. A little olive oil can work as well, especially if this is a child.
Yeah.
Then you definitely want to use the olive oil because it will blister the bottom of the child's foot.
Mm-hmm.
And then you're gonna put the foot on top of that, and you're
Mm-hmm.
gonna bandage it in place, maybe with
Mm-hmm.
cling wrap first,
Yeah.
and then you can just tie it with any cloth,
Mm-hmm.
an old t-shirt, or
Yeah.
when you have your old t-shirt, don't throw them away. Cut them, cut out the sleeves, and then keep them, because you realize when you need little things to make
Mm-hmm.
a compress for your throat or
Yeah.
wherever, then that's what you can use as your
Mm-hmm.
go-to. Yeah.
And then you just put your sock on over that
Yeah,
and walk
and you're good
around,
to
go to
go, or
bed.
go to bed,
Yeah.
whatever. And within minutes, you're
Mm-hmm.
actually tasting the garlic on your
Mm-hmm.
breath. Yeah,
And that's because you have huge pores in your feet. So it just absorbs it really
yeah,
quickly.
and then it clears the
Mm-hmm.
bronchial tract while it's doing all of that. So that's
Mm-hmm.
very good. And the sunshine, if you're having a sunshine that particular day, you can just go out and sit in the sunshine as
Mm-hmm.
well. That is very, very
Yeah.
good as well.
Yeah. So basically, from everything we've mentioned, the fresh air is important,
Mm-hmm.
the sunshine is
Mm-hmm.
important, water is important.
Yes.
We talked about, the importance of what you're eating.
Yes.
Um, yeah.
So we actually want persons to understand the importance of the laws of health.
Mm-hmm.
And that's why we're going through them. And we are not necessarily at this point giving you herbs per se, because we want persons to get used to using the laws of health. And then once we have covered all of those,
Mm-hmm.
then we will take you into the kitchen and show you some of the herbs that you can use.
Yeah.
But a lot of times we want the quick fix. So give me
Mm-hmm.
the herb, but then I'm still going to do all the other things that I'm used to doing,
Mm-hmm.
and that is not going to work. And
Yeah.
then they will say, "Oh, but
It didn't
it
work.
didn't work."
Yeah.
But it didn't work because we're doing it the wrong way,
Mm-hmm.
right?
Mm-hmm. So it's like, if your body is full of inflammation from the foods you're eating,
Yes.
and you decide, okay, I want to try this mullein tea, I mean, it might not work, or it might not work as
As effective,
effectively
yes.
because of all that inflammation that's
Mm-hmm.
already in the body.
Mm-hmm. And you need to sleep. Even lack of sleep will cause you to have
Yes.
inflammation in your system. So it's a package. It's an entire package.
Yes.
All right. So now let me see here. I want to introduce you to someone who has suffered from this condition for some time, and they will tell you how long they've had the condition for and what they have done over the years. I noticed that she was on video, but she's on the phone now. I guess she's probably having other challenges. So her name is Dorothy. Dorothy, can you hear us?
Yes, I can.
Okay, good evening.
Good evening, Sister Rosetta. Good evening, Donisha.
Hi, how are you?
I'm well, thank you.
That's good.
Okay.
And good evening to everyone else that is on.
Good evening, Sister Dorothy.
So good evening.
So do you want to share a bit of your story with us?
Yes. So now you have already know my name, Dorothy. I have been an asthmatic ever since I know myself. As a child, I had asthma, and so I struggled with it all my life.
Mm-hmm.
When I came to Canada, the first 3 years, I never had asthma, and I thought, oh wow, I'm cured. But then it came back,
Mm-hmm.
because when I came to Canada, I lived in the country for about 3 years. But
Okay.
once I went back to the city,
Mm-hmm.
it started again.
Wow.
And so I have been taking puffers all my life. Ever since I came to Canada, for many, many years, I have to take puffers. And so anxiety with me, sometimes that anxiety causes me to have an asthma attack.
Mm-hmm.
So I also have environmental allergies like ragweed, or sometimes when it's freezing cold,
Mm-hmm.
or when it's extremely humid.
Yes, the temperature changes.
Yes.
Sometimes I have asthma attacks.
Mm-hmm.
But many, many years ago, when I live in the city, Sister Rosetta visited the church, my church that I was attending at the time.
Uh-huh.
And she did a presentation on, it was on health, but including the 8 laws of health.
Mm-hmm.
And it was so very interesting. And I never told her this, but at the time I thought to myself, if only I could get to know her. That's what I thought.
Wow.
But then it so happened that many years after that, several years after that, I moved to the country.
Mm-hmm.
And I was searching for a church. And the second church that I visited, that was the church Sister Rosetta attends.
Mm-hmm.
And well, presently, that is my home church. I became a member of that church.
Mm-hmm.
But I have had asthma attack twice where I almost died.
Wow.
Really, really bad asthma attack where I almost died.
Mm-hmm.
However, approximately 3 years ago, Sister Rosetta gave me a regimen
Mm-hmm.
for to help me deal with the asthma, with the
Yeah.
symptoms and so forth.
Mm-hmm.
And I must confess that I did not follow it to the T.
That's okay.
But one of the big things that I realized is cutting out dairy.
Mm-hmm.
You know,
Yeah.
cutting out dairy was a big part of it. And I stopped eating meat. I think shortly after moving up here, I totally gave up meat after moving to the country.
Mm-hmm.
And so the regiment was, well, the 8 laws of health,
Yeah.
plus giving up dairy.
Mm-hmm.
And a lot of things that you and Sister Rosetta talked about earlier in this program, like drinking more water, getting proper rest, and using the oil of oregano and a lot of garlic. I use a lot of garlic, and thank God that I am a garlic lover, so I didn't find any problems with it.
Yeah, that's
Plus,
good.
what I find help also is the lung exercise, lung strengthening exercise. That do help a lot. But I just want to say that for the past 2 years, I have not had an asthma attack, and I give God thanks, and I thank Sister Rosetta very much because I used to frequently going to the emergency room because I've been having asthma attack, and so I'm very, very thankful. You know, because it does make a difference, a lot of difference. Because even today, as cold as it was today, I went out for about half an hour walk. Ordinarily, I could not do that because once I inhale the cold air, I would start wheezing.
Wow.
And occasionally, I still wheeze in my throat. When I wheeze, it's in my throat, but it's not in my chest. So my chest don't get tight and I don't get distressed, you know? So that makes a big, big difference. I still have to take the puffers when I'm wheezing in my throat because it still affects me.
Yeah.
But not as badly as when I used to wheeze down in my chest. You know?
Yeah.
So I am very, very thankful. And I try not to get anxious as I used to. So I thank God for Sister Rosetta, and I thank the Lord for you, Sister Donisha, and may the Lord continue to use you and your mom in this ministry and bless you abundantly while you continue to help others and to encourage others to live a better lifestyle that will, enable us to enjoy life better, because the Lord wants us to be healthy.
Yes.
And He wants us to prosper in our health, So, yes, I am very, very thankful to Sister Rosetta. To the Lord first, and then to Sister Rosetta. I appreciate you a lot, Sister Rosetta. And I appreciate you also, Danisha.
I appreciate you as well.
Thank you for the work that you're doing.
And thank you for, sharing your story with us.
Yes.
It's always good when we can hear personal stories.
Yes.
Because we could be here talking about this and that, and someone could be like, okay, but you don't have asthma.
Exactly. And that is so true, because I think those of us who have never had an attack, we take it for granted. We take the fact that we can just breathe and everything is normal.
Yes.
We take that for granted.
Yes, we do.
Yes. Thank you very much for sharing, and we do appreciate it, and I am so thankful. The last maybe 3 weeks, we have had very, very cold days every day. And one day I called her and I said, praise God, you have not had an attack this year.
Wow.
And I was so thankful, because he who feels it knows it. And I know that she knows, because she has felt it and she has been there. So we hope that for those of us who have never had an attack, you will take this information and you will use it to help someone else as well, who may be in your family, or someone that you may know, a neighbor, somebody that it can be of help to them as well. Yeah.
I'd like to say also that I'd just like to apologize. I tried signing on the iPad because I would like people to see my face, but unfortunately, I was having some. I was
Don't
having
worry
some
about it. That's
We'll
okay.
see your face in another time.
Okay.
So, yeah, I saw you earlier on, so I figured that you were having some challenges.
Yes. Yes.
Yes.
Yeah.
But yes, I'm glad that she's in my life. I know her daughter is on. I can see Michelle, but I call her mother dear. She's my church mother, and I love her dearly. She's very, very, very nice person. God bless her soul. Yes. Yes. Okay.
Thank
So
you.
someone's asking with
Oh, her granddaughter's here as well.
okay.
Thank
Okay.
you both for joining us this
Yes,
evening.
thanks, Michelle and Shantae. Okay. So with posture, is it helpful to sleep with a lot of pillows?
What do you call a lot?
Yeah.
That was my question that I had placed, or maybe I'll just show my face. That was my question that I had placed in the chat in regards to if it's helpful to sleep elevated with a pillow when you were speaking in regards to posturing or ensuring that your posture is upright. Then do pillows help with the breathing at nighttime? Should we be sleeping elevated?
I
And if
think
I missed that, I apologize.
oh no, you didn't miss it. I was wondering if Sister Dorothy was gonna say something.
Yes. Of course, when you're wheezing, you have to elevate your head. There are times when I couldn't lay down at all. There are times when I sat up through the night.
Wow.
But yeah, so when you're wheezing, you need elevation. You need your head. There are times when I would sleep on 3 or 4 pillows, or even full towels, and put to make them higher.
Yeah.
But yes, you definitely have to elevate your head.
Yeah.
And
Thank you, Mom.
it makes sense too.
I just want to say, may I just say quickly, please, if you don't mind, that when my mother had shared about the 2 times, it's very emotional. Because I remember one specific time when I was a child when my mom had a severe asthma attack, and I thought I was gonna lose my mom. So yeah,
Yeah.
I thank God that she's strong and going in all of that, and thankful for her church family and all of that, and all of the wisdom that my mother continues to share with me and my children as well.
Thank you for sharing that.
Yes.
Yeah.
And I'm here laughing, Michelle, because I see your note in the chat. I'm glad you're willing to share her with me.
Yes, just a little bit, just a little bit.
Wow, this is nice.
Yes.
So good to have personal stories and, even family stories too.
No, Vince, you have to give me some more time. I want to make sure she's quality.
Okay, sorry about that. Yes, so we really hope that, everyone learned some information tonight about asthma. You heard the personal story and the struggles as well that come along with it. And we're hoping that, some of the things that we shared can definitely help you if you have asthma or if you know someone that has asthma.
Okay. All right. So we're almost out of time. And again, we just want to remind you that the information, usually it's posted on YouTube and Facebook on Sunday afternoons.
Yeah.
So you can share it with your friends and let them know that they can also join us weekly on Thursdays for our weekly session. And we are also making other plans that we want to share with you, but we are waiting for a little bit more. Maybe next week we will let you know what those plans are. So keep joining us, and we will always let you know what's happening
Mhm.
and what is the next thing that we're doing.
Yes.
So we encourage you, as usual, it's
Mhm.
Rosetta,
And
Donisha,
Mhm.
to start your journey
Towards
towards better health today.
today.